The content and the session today is focused on the future face of medical practices. And why this is so important for a larger discussion is that every single session that we talk about comes to a head in the institutions represented. These medical institutions are the hub. They are the intersection of policy, innovation, and patient care. It's where it all gets played out. But as we know, these models, these traditional models, are in flux. They're in flux and they need to innovate, but obviously, if we've talked about, shackled by bureaucracy, regulations, and high cost. So what are leaders doing today to innovate within the confines of their respective models? What do the models of the future look like? And while we may not be able to predict some of these dynamic changes, how to at least structure institutions in a way that can be as adaptable as possible to these uncertainties. So with me, I have Todd Albert, who's the president of the Rothman Institute, and Sandra Fenwick, who is the president and newly appointed CEO of Boston Children's Hospital. And each within their respective realms, they're innovating to become 21st century institutions. Sandy, I'll start with you. Obviously, academic medical institutions are much more entrenched in traditional structures, silos, much harder to make the types of changes that are needed to be sustainable for the future. 5 years ago, you recognized a very dramatic problem when you saw the costs were unsustainable, but you took very dramatic and unconventional approaches to curbing those costs, particularly in light of your peer set. How did you go about implementing that strategy, and what have been some of the most effective and also unexpected levers of change?
So I think 5 years ago, we realized when we started to really dig down and look at what was sustainable in our organization, it clearly was that we ourselves couldn't afford health care for our own employees. The 9,000 employees, 1,000 doctors, 1,000 residents and fellows, they were growing at 12 to 14% per year. So we said, we really have to be part of the solution, not just part of the problem. We looked at two elements of this. One is, how do you actually look at the unit cost of care and really try and strip out costs so that your unit price is as cost effective as possible. We've been able to take $200 million out of almost $1 billion clinical operation, doing a whole host of Lean, Six Sigma, other kinds of cost reduction efforts. But the other half of the coin is utilization. And we said, in order for these changes to be sustainable, we really have to fundamentally change the way we deliver care to patients. And so we basically said, we've got to educate our entire community inside around how we need to do that, how everyone at every level has to basically figure out what we can do differently around the how, the where, the who does it, the engagement of patients and primary care and community physicians, the information and technology that we use. And so we basically went out and challenged with sort of an aspiration of we can change the way care is delivered for kids. And within 2 years, we had almost 200 initiatives going on in almost all of those areas. Just give you a couple of examples. We're now using a robot to send home with kids post-op after surgery. And the surgeon is now working with the family and empowering and enabling both the family and the specialist to monitor that child at home. It's hard when that robot has to go home. The kids get to love them. We are in asthma in the community. We're going into homes, and we are now making sure that the environment in those homes are free from dust mites and rodents and cockroaches. We've been able to reduce the emergency unit visits of the 1,000 kids we have in that program by 65%, and admissions to the hospital by 85%, in just changing the way we think, not just about what meds they're on and compliance with meds, but the environment these kids live in. We have moved an enormous amount of care all the way down the continuum from intensive care unit outside the hospital to enabling primary care doctors now through teleconsult and teleconnect to really keep kids either in their practices in the community or in the community hospitals that we staff in the emergency rooms, the ICUs and the like. So there's many, many different ways that we have done that. And what's exciting is that we're celebrating those internally, and we're just seeing that more and more and more of the physicians, the nurses, the teams are now embracing that.
Todd, you are looking at this model from a very different perspective. The Rothman Institute has a hybrid model. You have an academic component, but you're not dependent on traditional academic centers. You're tightly aligned. You have a single orthopedic focus. You have regional scale, but you also have these entrepreneurial underpinnings that have created a culture where innovation is hardwired into what you're doing. Much easier said than done. What does that actually look like in practice, and what's the biggest challenge in doing that?
So people always say, what's your challenge? And I always say the biggest three challenges are culture, culture, culture. Our practice started as 6 orthopedic surgeons, academic orthopedic surgeons in 1997. We're now about 110 physicians, about 60-40 surgeons to non-surgeons. And so we've had rapid growth. But with that, we've always wanted to, those 6 guys, they weren't the same people, but they had very similar culture. They all wanted to be very academic, write a lot. They wanted to be high volume, specialized, terrific surgeons. And they were similar in what they wanted. And so to transmit that to 100 people is difficult, but we do it actually through the academic core. That's how I think we keep together. We have a system where people have to hand in every year academic points. They get points for it. And we've grown significantly across multiple health systems. We have great health system partners, and our core being at Jefferson, that's our academic core. But people, to be a full shareholder in our group, to be able to own part of the group, which has MRIs, has orthopedic hospitals, they have to be at an associate professor level. It's important to us, and we reward that culture.
So you're hardwiring some of the best practices or the advantages of other models into what you do through very defined strategies, structures, and the like. Sandy, speaking on that talent and being a change agent and bringing a traditional organization through this dramatic process is also very difficult. You had said that in a children's hospital, that team focus is perhaps more central than other like institutions, but you've also had to transform those teams and how they work to be greater stakeholders in the innovation that's going on. But you've also had to create greater stakeholders outside of the institution, which may not hasn't traditionally happened with Children's Hospital, to have that type of collaboration. Why was that so important for you?
I think you're right, Maura, that in pediatrics, the focus on the family and the child has always been key in taking care of kids. So we basically have, I think, a team sport in pediatrics. But moving from we can solve every problem internally. We have all the answers to, we need partners. We need to partner outside the institution with primary care doctors, with community-based, with schools, with community providers at every level, and also with companies and organizations that can help accelerate the change that we're trying to make. So, for instance, we are working with IBM on a product that will hopefully leverage the education, the development of capacity building and capability, not just in our local communities, but basically globally. We're working with Ian Torrent on where we had talked about building our own capability and capacity inside for genomic testing, and then incorporating that into the practice, in clinical practice. But we realize that instead of doing it just inside, we really need partners to work with us to accelerate and to leverage their expertise and talent just as much as ours.